When acquiring blood pressure readings, it's important to use the proper size blood pressure cuff. To verify the proper cuff size for a patient, wrap the cuff around the patient's extremity. The index line, or white arrow, should fall within the white range markings on the cuff. If a patient falls between two cuff sizes, always use the larger cuff. Place the cuff brachial artery marker over or close to the brachial artery. For the best results, wrap the cuff snugly so that there is room for no more than 2 fingers under the cuff. Do not wrap the cuff over a patient's clothing. According to American Heart Association guidelines, the patient should be seated comfortably with back supported, legs uncrossed, and feet resting firmly on the floor. The patient's arms should be supported at heart level and kept relaxed and motion-free. The patient should not talk or move during the BP measurement. To initiate a blood pressure measurement, make sure IQvitals is in the main testing screen. There are 4 blood pressure setting buttons to choose from. These can be preset to pressure settings of the user's choice. Ideally, the initial inflation cuff pressure should be about 30 millimeters of mercury above the patient's systolic pressure. Using a higher pressure may cause the patient unnecessary discomfort, while choosing a pressure that's too low may cause the device to reinflate the cuff in order to obtain a systolic pressure. When a BP measurement is started, the stop button will be highlighted, and you may stop the measurement at any time by pressing the button. When the measurement is stopped, the cuff will deflate and all buttons will be enabled. While the BP measurement is running, the in progress wheel will appear. When the BP is complete, the systolic and diastolic values appear on the screen and a pulse rate will be displayed. To perform an SpO2 measurement, place the sensor with the LED light positioned at the fingernail. Insert the patient's finger, using the left or right index finger, completely into the sensor. If a blood pressure measurement is occurring simultaneously, place the finger clip sensor on the limb opposite the one with the blood pressure cuff. When the sensor is attached to a patient's finger, an audible tone will sound and the in progress wheel will appear. Once the measurement is done, another audible tone will sound and the SpO2 value will appear. If the sensor remains on the patient, the pulse rate bar on the screen will become active. To take a temperature, check the appropriate button in the main testing screen, oral for oral readings and axle for axillary readings, and make sure that the button is light blue. Remove the probe from the probe well, grasping it in the top blue area between the thumb and index finger. Do not press down on the area where the cord comes out of the top. An audible tone will sound when the probe has been removed from the storage well. Insert the probe in the probe cover and gently press down on the cover to ensure a secure fit. Place the probe in the appropriate location on the patient. Hold the probe during the entire measurement procedure, keeping the probe in contact with tissue at all times. During temperature measurement, the in progress wheel will appear. An audible tone will sound when the measurement is complete, and the patient's temperature will appear below the temp button on the screen. If there is a delay of 1 minute or longer from the time the probe is taken out of the well until a temperature is taken, the device will not take a temperature. You must put the probe back in the storage well and remove it again to reset the thermometer. To remove the probe cover, hold the probe as you would a syringe and press the eject button at the top of the probe. Place the probe back in the storage well to reset the thermometer for the next patient. A Fairbanks Tellaway digital scale can be used for collecting patient weight. Once connected, the IQvitals device will automatically detect the scale. The scale will be ready to use and will automatically transfer the weight measurement to the IQvitals device. If connecting IQvitals to the Midmark 625 exam table with IQ Scale, the table scale button will appear to the right of the clear button on the main testing screen. If either the weight button or the table scale button is pressed, the Midmark 625 with IQ Scale screen will appear. The arrow buttons control table movement. The Quick Exam button sends the table to a pre-configured position, and the Home button returns the table to a default position. Press the red button at any time to stop movement of the table. When the Zero Scale button is pressed, the button will display the In Progress wheel until the scale is zeroed. Once the scale is zeroed, a Scale Ready message will appear. Then press the Weight button. The In Progress wheel will appear during weight acquisition. The weight data will appear on the screen once the weighing process is complete. Press Save to save the weight measurement.